afternoon, everyone. It's C.W. Hall, your host here on Top Docs Radio. Thanks for making us a part of your afternoon today. Happy to be joined in studio today by Dr. Kenneth Anderson of the Anderson Hair Sciences Center and some of his folks, a teammate of his and one of his patients who will be able to tell us a little about his story. And we'll start with Dr. Anderson. Thanks for joining us today, Dr. Anderson.
Thank you very much, CW. Thanks for having us back.
And we have Sarah Kovac, formerly his surgical assistant, but now the important role of patient advocate. So yes, thanks again. Sorry to cut you off there.
Hi, nice to meet you guys.
And we have a client of Dr. Anderson who will be able to share his story, patient John Williamson.
Hey, thanks for having us here.
I appreciate you taking time out of the day. And so Dr. Anderson, from what I understand, in this community, you're one of the first providers that has robotic hair restoration as a service that is enabling you to provide hair restoration with minimal scarring, minimal recovery, only 40 of them in the world, and yet here the folks in the Atlanta market can come and get your service with expertise from you. So tell us a little bit about the value that brings to your patients when they come to see you.
Excellent question. Well, hair restoration has come a long way from the 1970s and 80s when it was a pluggy doll's hair appearance. In about 2004, a few doctors and I in Beverly Hills started using small 1 millimeter punches to remove the hair from the donor area and place it into the areas of need for those gentlemen who wanted to have a hair restoration surgery but who did not want the telltale linear scar in the back of the head. However, because this was done using handheld instruments, there was some transection of the hairs and a little bit of an issue successfully transplanting the hair every time. Well, in about 2013, we were awarded the contract for the very first and only hair restoration surgery robot in the state of Georgia. And it is a fascinating piece of technology that allows patients to receive a hair transplant without having to have any linear scar. They can have the hair as short as they like.
So I actually know somebody who had the other type of surgery, and you're right. I mean, he does often wear his hair on the short side, and you can still see that scar that you're talking about, and as we sit here with one of your clients, I mean, I never ever would have known that he'd had a procedure done to restore hair, so it looks fantastic.
Thanks very much. Yes, here we have to my right is John Williamson. He's a patient of mine from April of this year, and he underwent a robotic procedure. How you doing, John?
Doing good, man.
Okay, and he's here just to tell us a bit about, what the patient experience is like.
It all starts with doing a lot of research. 35, started losing my hair a little bit, I guess when I was about 32, 33, and my problem was losing the hair in the front hairline. So, what do you do about that? I got on Propecia, actually, after I met you. We did a consult, and you gave me Propecia, and that worked, and there's a lot of options out there. There's a lot of hair restoration places that I walked into, and I felt like a salesman was selling something. Mm-hmm. And I wasn't looking for a sale. I was looking for a fix. And I guess my point is, you've got to do your homework. You've got to weed through a lot of people to find the real deal. And when I met, I call him Ken now. When I met Ken, he wasn't selling me. He was showing me results of what he has done with other people. And I said, I want my hairline back. Is that possible? And he said, absolutely. What's your goal? And I said, to fix the front of it, the back looks good. A couple months later, we actually, started the procedure. And I was excited. I'm more excited now because I guess 8 months later, my hair's back, my hairline's back, and it looks great. No one really. I don't walk in a room and people are like, wow, what'd you do?
Right.
But I notice, and my wife notices, and it's just, it was a great experience. I would recommend it to anyone, but I would recommend that anyone, they've got to do their homework, and you're going to see a lot of places that say, hey, we're running specials. Do you really want a special on your hair? Right. I want a special on my tires, not on my hair.
As we talked about, when we were introducing you, obviously you're a young man. What was the process like for you, from a quality of life perspective, your personal self-image that made you finally be motivated enough to explore hair restoration for you? And kind of walk through that process, because I think a lot of people may presume that it's kind of an older man's thing, but obviously you're a young man and you're engaging in sales activities, and you want to go out and put on a good presentation of yourself. So, I mean, what was it like for you as you started losing your hair?
Well, yeah, you mentioned I'm in sales, and part of being in sales for me is having confidence, and when you lose hair, you lose your confidence. I mean, at least that's how I feel. I'm sure other people feel the same way, but step one is actually doing the research and talking to someone and saying, is it possible for me to get the results that I'm looking for? And that's why you do the consult. But I was a little depressed, and I kept researching, and then I finally met with Dr. Anderson, and I talked to my wife about it, and she was like, man, stop talking about this. That's all you talk about, this and football. She was like, luckily my team is winning this year, so, I mean, the hair was, this has been a great year for me. I've got my hair back. Mississippi State is #1 in the country. Sorry to plug that.
Hail
but,
State.
No, it was great, man. Like I said, it's I really believe in spending money on something that's going to make you happy. And I wasn't looking for a sports car or anything like that. I was looking for something that's going to make me happy. So yeah, it was a great decision. I would do it again. I would recommend it. I told Ken, I said, man, give my number to anyone. If they want to call me and talk to me, I'll walk them through it. It didn't hurt. I don't have a scar on the back. I see people in the grocery store with a scar, and I'm thinking, man, I'm glad I didn't do that. I'm glad I actually, put forth the effort to find the right person to do this. And, at the end of the day, it's about finding the right person. And luckily I met him, and it worked out.
You mentioned the fact that a lot of the places that you explored to begin with were trying to win you over with, prices or sales prices and things like that. When you got to Ken's office, to talk about your experience as a patient through the consult process and kind of what finally won you over that this is what I need to do.
Yeah, well, so I met Sarah, and she was real nice, and she said, I was asking her all these questions. She said, the doctor's going to come talk to you. And I thought, oh, the doctor's going to talk to me. Most other places, a salesman is going to talk to me.
Interesting.
I don't want you to sell me. Like I said, I want to talk to the person that's going to have their hands on my head and actually facilitate this. So once I talked to Ken, he said, I'm going to show you some results. Plain and simple. This is what I do. I specialize in this. If you specialize in something, you better be great at it. And he showed me some results. We looked at different options. The artist robot was perfect for me, and I was, I did my research on it. I was really intrigued of how it worked, and no scar, you get your hair back. At the end of the day, that's priceless.
Can I ask a question?
Sure.
So it kind of described to me how bad it was.
Okay, did I show you a picture earlier?
Yeah, you did, but,
obviously
you didn't show
you guys can't
the
see the
listeners,
picture.
but
So I kind of had the horseshoe. I don't know. The easiest way to explain it is, I have a lot of real estate on my forehead, and when the hair started receding back, it looked like my forehead got a lot bigger. Some people lose hair in the back, some in the front.
Right.
I'll be honest, I'm not going to look good bald. I've got big ears, big forehead. It's not going to work out for me. Some people look great bald. Bruce Willis, Vin Diesel. That's not me.
Yeah.
No, but it's a night and day difference, and I feel like I got my money's worth, and it was just, everything was great. The procedure was great, the recovery was fine. The worst thing you're going to deal with is a bad haircut for maybe a month. You're going to get kind of a military style haircut because you got to cut it short, at least for my procedure. And yeah, man, it was great. I would do it again in a heartbeat.
Can you talk about what the process was like? You mentioned the fact that the procedure itself was, not very uncomfortable.
Right.
What was the recovery process like for you?
Recovery process, Dr. Anderson gives you the post-medication, so it reduces the swelling and things like that. He gives you step-by-step instructions of this is what you need to do day 1, day 2, all the way to day, 40. It was easy. So I went in that morning, got the procedure done. My wife picked me up at the end of the day. The next morning I woke up, there wasn't a lot of swelling. The recovery was me sitting at home watching television. That was the easy part about it. But
and how long was that?
Total recovery. Here's the cool thing about this procedure. Your results aren't immediate. So you don't wake up the next morning with a full head of hair. I'm still growing hair right now in front of you guys. Look at me. This hair is growing.
It's crazy. It's going. It's amazing.
you know, every month, your hair grows a little bit more. I think the peak months are about 6 months. Is that right, Ken?
That's about the peak growth month. A lot of times it takes about 8 to 12 months, depending on the person, for the hair to really fully grow in.
Right. You know, it's kind of fun to every week look in the mirror and say, wow, I got more hair.
And so how long were you home from work?
You know, I took about a week off, and you know, I was back, and you know, luckily I could work a little bit from home. But if you have the type of job that you could wear a hat or something like that, I mean, that's ideal. Nobody's gonna know. I mean,
Do you?
No, I don't have that kind of job. I'm in sales, so I have to be in front of people, and you know, the only comment I got a week later was, "Well, you got your haircut short." I said, "You know what? I went in for a $10 haircut, came out with a $2 haircut, so I got a bad haircut."
That's great.
And you know, I still have a few people that say, "Man, you remember when you got your haircut?" I said, "Yeah, I remember." But no, it was great. Like I said, it's not one of those things that's so noticeable that when you walk in, someone's like, "Wow, you got something done." It's a gradual growth of the hair, so that really prepares people to, you know, there's no shock.
We've been talking to client of the Anderson Hair Sciences Center, patient John Williamson, and Dr. Kenneth Anderson. And when you were interviewing your prospective hair restoration specialist, did they talk at all about their clinical background? What kind of focus they had prior to getting into hair restoration? Were they plastic surgery? Were they
No.
general surgery? What kind of physicians were they?
You know, honestly, a lot of the other places, I never talked to a physician. It was a salesperson, and they're going to come in and say, "Okay, first off, we're having a sale on this." I'm like, "Okay, well, you know, show me the results." Like I said, I'm not worried about the sale. I mean, it's you get what you pay for out there, and you know, like I said, so I never talked to another physician, and so I was kind of surprised when he came in the room, and I was like, "Okay, so who does this?" He's like, "I do it." "What are you talking about?" You know, sent me in his office and, you know, showed me some pictures. And for me, results are what I was looking for. I wanted to see, like, it's funny, he showed me a lot of pictures, and I said, "Now, did you do this?" He goes, "Of course I did this." You know, but the reason I bring that up is some of the other guys, they can't say that. They can't say, "Yes, I did this." I mean, a lot of I noticed, I saw the same picture of
Yeah.
different people, like they bought a stock photo, and they're showing me results of the procedure, but not necessarily what they did. So, you know, it's worth it to do your homework, find the right person, and like I said, you know, go see Dr. Anderson. He'll give you my phone number, and we can have the same conversation on the phone.
Well, when you combine the background in facial plastic surgery, Dr. Anderson, with what the robot can do, I mean, how does that differentiate you from, you know, some of those other folks that are out there?
Well, I believe a lot differentiates our practice. It's about in 2003, I joined a busy practice in Beverly Hills, and that's right about the time that hair restoration went from the pluggy look to the single hair at a time look. And this was a really advanced practice. They were coming up with a lot of new stuff, and the follicular unit extraction procedure, which is what we're talking about, which is what the robot performs. It had just, you know, we were just coming up with it. So I elected at that point. I looked around, I saw, geez, you don't have to have a board certificate in anything. And now in this country, physician's assistants are allowed to independently perform hair restoration surgeries, you know, as long as they're a doctor somewhere on the premises or maybe in the building. I decided that this was going to be a growing field, pun intended, and that it was a real future in this, because hair loss affects well over 50% of men, and so, my friend, you're not alone. And it affects about 40% of women as they get older. So I thought, geez, this is, you know, a great opportunity for me. It's a wonderful and very pleasurable surgery. I love the actual procedure itself, but what I love most of all is the happiness that I'm able to bring to patients. You know, the worry that people have about looking at their hairline receding, and, you know, we associate that with age. It causes a lot of people a lot of concern and distress. When I'm able to replace the hairline with very minimal evidence that anything has been done in the donor area, and of course in the front, where people are actually looking, it should look, I mean, the hair restorations, the best hair restorations in this country should fly completely under the radar. And it should look like the hair has always been there and not like someone has put it back. And that's what we do every day at the Anderson Hair Sciences Center. And I tell my patient advocate and my employees that, you know, we don't sell hair transplants. We sell happiness. We really do. We sell happiness and confidence, because, geez, the stories I could tell you about patients who've who say I saved their careers, soap opera actors in California and the like. It's a very powerful procedure because we all used to have hair and it's associated with use, and losing it is very stressful for many, many, many people. So I love the procedure and how much happiness we're able to bring to folks.
Well, your passion for what you're doing is obvious in when you get to talking about what you do. And I think that sometimes it's easy to kind of trivialize aesthetic procedures, whether it's, ones that, say a woman might go for face or other features that they're less than happy with, or, in this case, a patient that's having some frustration and self-image issues over the fact that their, hairline is changing for the worse. And I believe that those types of body image issues can contribute to your overall health. I think that when you don't feel good about the way you look, that you can make choices, with your other health, activities, that whether when you feel better about yourself, tend to make better choices, and what you eat, you tend to feel like being active to make yourself look good, like you feel, great about your hairline now, so maybe I better, get in better shape. I think that those types of procedures can actually help contribute to someone's overall state of health, even though it's kind of an indirect way, but I do believe that it can pull them towards greater health just because they feel better about what they look like.
I would very much agree. I'd very much agree. The patients report, a lot of them are very satisfied with the procedure. And you'd asked me a second ago, what sort of differentiates the practice and why I went into this. I discovered it's the procedure itself is not very medically invasive, and that's why any doctor can do it and any physician's assistant can do it. But they can technically do it, but can they do it well? I brought to the table my background in facial plastic surgery. I'm also a formally trained artist and medical illustrator. And so really combining those two fields is what hair restoration surgery is all about, because when a man loses his frontal hairline, replacing it is not that intuitive. You have to kind of look at the face, the shape of the head.
How to frame it.
And to frame the face and to make it look like it's always been there. And there are a lot of complex subtleties. So I realized this back in 2003 and decided I don't even do Botox anymore. The only thing that we do at the Anderson Hair Sciences Center is take care of patients, men and women, with thinning hair or hair loss. And we're proud to offer, it's a boutique style clinic, and I never perform more than one procedure per day. I meet with every single patient to go over their concerns, as I did with Jonathan.
Well, we've been talking with Dr. Anderson of the Anderson Hair Sciences Center, and obviously being one of the first physicians in the world who offers this type of robotic hair restoration procedure, that certainly sets you apart. But I know that there are some other healthcare innovations that you offer that aren't surgical in nature that may possibly help somebody that maybe they can achieve their goal without surgery. Can you talk about some of those things?
I certainly can. In the last 5 years, there have been a number of advances in the field of non-surgical hair restoration. And by that I mean ways to preserve the hair that's remaining on the head and in some cases grow it back without performing any surgery. Hair loss is itself a permanent condition and it is progressive throughout one's life. The hair restoration procedure, really no matter which way you slice it, is just a redistribution of whatever hair happens to be remaining on your head. So it's important, especially for younger gentlemen, like Jonathan, to keep the hair on his head, so that we don't have to do 4 and 5 operations over the course of his life. And so we have several new treatments. One of them is platelet-rich plasma with ACell, which is a biotechnology product that activates the platelets. Essentially what Kobe Bryant had for his Achilles tendon.
Yeah, there's a lot of different medical uses for it.
That's
Very
correct.
cool.
It's been proven to increase vascularity. And in the hair, we apply it just under the skin and among the hair follicles, and that tends to rejuvenate some of the hairs that are trying to fade away as a result of the hair loss process. We also have low-level laser therapy. And you can there's laser caps we have where you wear the cap 30 minutes 3 times a week, and that I think is the most promising technology that we have. It is interesting to note that hair loss has no cure. There's no cure for it. There's no cure for acne either. Yet I'm quite sure that they sell quite a bit of Clearasil down there at Rite Aid.
Right.
It's a multi-billion-dollar market. We've all experienced the acne, or seen people with acne at some points, typically in childhood. So we're very familiar with that. The laser cap technology, it is not so familiar to everybody. They don't sell them down at the drugstores, but it has 4 and 5 times the success rate of any Clearasil or acne medication that you could find. A study came out in January of this year, a really well-designed study, the double-blinded placebo device-controlled study in which basically they gave a whole bunch of patients a real laser device, another group of patients a fake laser device, and the patients didn't know if they had a real or fake one.
Right.
Had them use it for a year, came back, and had a bunch of physicians use microscopes and look at the hair shafts and at the condition of the state of the progression. And what they found, and the physicians didn't know whether the patients were using the real or the fake device. And that way eliminates all the human bias from the actual study. And what they found was over 85% of people who use the laser device report that their progression of the hair loss either stops or dramatically slows down. And over 50% of the patients report that their hair shaft diameters increased and that the follicular density increased, all to say that those are fancy words for their hair grew back.
Wow.
That's over half of people with, with hair loss. So those are two of the technologies that we offer. There are a few others, but I think those are the most promising and up-and-coming technologies that will continue to revolutionize the field of hair restoration surgery.
So explain to me the science on how a laser would help hair grow.
The laser devices are, it's not like the laser you think in Star Wars. It doesn't hurt you. It's more of a laser pointer level of energy. It doesn't burn your skin like some of the laser devices that are used in cosmetic surgical offices. In essence, what we found is that the little lasers, they're 5 milliwatt in strength, very small, and they shoot out just one wavelength of light. There's no ultraviolet radiation emitted from these lasers. It's simply light of a single wavelength, which is 590 nanometers. And what we found through research is that light, at that energy, that light wavelength, penetrates the skin just enough, and it causes what we call an increased cellular respiration in the hair follicles and skin. And that's a fancy term for, the way I put it to some patients is you're essentially sending your hair to the gym. The hair follicles take in more oxygen, they put out more carbon dioxide, just like every cell does. And what they do with that is they make more ATP, or adenosine triphosphate, which is the molecule that is the currency of energy in our bodies. So essentially it's literally giving the hair more energy to grow.
That's pretty crazy.
It is. It sounds crazy, but it's true.
And so is that
I think that's a song.
You know, when we were growing up, it was, especially with long hair, our moms would always brush it 100 times every night to basically make it thicker and healthier. And it's almost like a expedited brushing. Sounds like it's a tickling the hair shaft to condition it.
Well, I'm not sure if it's tickling, but and I use one device myself. I put it on, because I might have some hair loss. I might be starting. I'm trying to just prevent that, keep it on my head. It doesn't feel like anything really. You kind of put it on. It has a baseball cap that comes with it and a little cord that snakes down your back. So you can wear it, if you have a half-hour commute to work, there you go. You just put it on your head and no one would ever know. But it stimulates the hair. But I've never heard of the brushing the hair 100 times. I don't know that.
Oh yeah. Yeah, whenever I was a kid, I remember
Really?
girls talking
Oh,
about
yeah.
that. Their moms wanted to brush their hair and sit
Huh.
and brush it and brush it, brush it. It would seem to me that the mechanical brushing would probably be detrimental in the end, but
Well, I'll tell you exactly what it does. What it does is pull out a lot of hair.
yeah.
And pretty much the hairs that are on their way out of their cycles, because all hairs on the human body have cycles, and as they're coming out of their growth cycle and coming into their resting phase, the attachments under the skin of the hair start to be dissolved by the body, and that can take a couple weeks to fall out. But if you brush your hair 100 times every night, they're not going to take a couple weeks to fall out. They're coming out right now.
Yeah, so I guess he just probably pulls out the old guys and leaves the fresh guys, but in the end, you're expediting your hair loss without even realizing it.
Not unless you're experiencing hair loss, because if you're not having hair loss, the hairs are going to come back as thick and as strong as ever.
Well, maybe I guess it just keeps the dead guys out. The hairs that have already kind of reached the end of their cycle, maybe they're not as pretty, so it probably makes it look
You
more
must have the
fresh
most
and fresh.
fascinating conversations over the dinner table.
I do.
As a
I
matter
do.
of
Thank you
fact.
for asking.
Well, so, one of the things that we talked about in your practice is the process that a patient goes through as they come on board and try to determine, is this the practice for me? And obviously, one of the first folks you're going to interface with, as Jonathan talked about, is Sarah Kovac, the patient advocate. And talk a little bit, Sarah, about, what is your role and how do you help guide the patient through making this decision and following them through the course of their interaction with Dr. Anderson?
Most of the time when I first start speaking with patients, it's either my first encounter is on the phone or it's actually in person, following up with them via email, a lot of it, and this is, I think, one of the largest distinctions between Dr. Anderson's practice and some of the other ones that I've spoken with patients about, is the fact that he stresses education, understanding exactly what's going on, but we're looking out for the patient. That's always the number one priority. And I mean, I don't always hear that from the patients, and that was a large concern of mine, and I think that's part of the reason why I very much wanted to kind of move into more of this kind of a role than I was as just a surgical assistant. I very much miss being the surgical assistant. That was a lot of fun. I definitely enjoy watching him do surgery and assisting him perform it, but somebody needs to be guiding patients into what's in their better interest, not just, you know, we're having a price sale.
Right.
So
It's a big life choice, and you know, I think it's certainly distinguishing that we're not talking about trying to lure you in because normally it's X $1,000 or X $100, whatever the case may be, and now it's this. We're actually setting you down with a clinician who's going to be able to, you know, help kind of find out what are your goals and maybe begin to identify potential options and focus on the clinical outcome rather than a financial choice.
That's a very good point. It's a very good point, CW. The reality is what a lot of people don't realize is that corporate medicine is a term out there.
Yeah.
And that is a term that was, you know, started in different areas, med-spas, but definitely in hair restoration. Corporate medicine has been around since 1975. There's a major company out there, I'm sure we're all aware of, and it was called Bosley. Dr. Larry Lee Bosley founded the company in 1974. It is interesting to note we all have to thank him as physicians for the ability to advertise. You couldn't even be in the Yellow Pages, and Dr. Bosley went to the mat in the 70s to change all that. Be that as it may, Dr. Bosley sold his company to a Japanese hairbrush company that's publicly traded on the Tokyo Stock Exchange in 1997. So it's been just about 20 years since he did any operating. And so now, you know, since it's a public company, you know, they're existing to pay the shareholders. So that's just one example of the way that this, you know, the procedure and the treatment and the therapy for hair loss can be delivered, you know, in a corporate setting with, of course, profits above all else. Then there are a bunch of practitioners out there, some of who are somewhat serious and some of who are very and solely dedicated to the specialty. And we would fall under that category because I think that's such an important life change. We do say in this field, it's a funny little joke, but it's not that funny if you're falling the wrong side of it. The good thing about hair restoration, you know, it's permanent. The bad thing about hair restoration is that it's permanent.
Right.
And if it's not done correctly and you're not happy with the results, there's going to be some difficult discussions you'll be having with your physician. And so over the past 11 years, it's because I've dedicated myself and my practice to the specialty. I think we've done a very good job at producing very natural results and minimizing, you know, patients who are unhappy with the results, because I tend to be real conservative. You don't want to put a hairline that's really low on someone or straight across. It has to look absolutely natural.
Right, and those are the reasons why I think it's important that patients, you know, understand that there are very big differences across the board available to them, and just because somebody's on an ad on television doesn't necessarily mean that's the best choice, particularly if they're really trying to bring you in based on, we're running a special today, so come in and get 2 follicles for 1. That's not necessarily the best choice. I think I'd rather go to a board-certified specialist that's going to use the latest technology and innovations to get my hair restoration done. And you know, before we jump over to our next guest, do you have some final thoughts there?
Yeah, I just got to say, it's a rapidly growing field, as I mentioned, and a lot of you know, plastic surgeons across the country are buying a device that may do the follicular unit extraction, and then, you know, they're already doing maybe breast surgery or otoplasties or other sort of plastic surgery, and they'll buy the machine and add hair restoration onto their long menu of services,
Right.
having never performed a hair restoration procedure. The technicians to run that machine currently run $70 an hour, and so that's really, you know, if you were a practitioner, you could buy this machine, hire the technician, and I do have colleagues who brag to me that they never even see the patient. This is happening today, all across the country. So it's important to sort of separate the wheat from the chaff, because there are not many if there are very few dedicated hair restoration surgery centers that are not corporately owned and that are not, you know, a product of a surgeon who like bought a machine and is dabbling in it, offers it in addition to Botox and nose jobs and the like.
Right, so for the man or woman that's sitting out there listening to us today, can you give them maybe some good questions that they should ask to a prospective provider? Maybe they're not fortunate enough to be sitting in Atlanta trying to make up their choice, because it seems to me that the only physician that offers the robotic hair restoration services in Atlanta would be the clear choice. But are there some key questions that maybe they should ask? You know, you mentioned the fact that sometimes the physician doesn't even see the patient through the procedure, so that would obviously be a key question, but what else?
Well, that would be, yeah, it'd be a giant red flag if you didn't meet with a doctor, because that's, how do you know who's going to be doing the procedure? So that's one of the things. Who is going to be doing this procedure? What, if any, surgical training do they have? Do they hold a board certificate in any surgical subspecialty at all? How long have they been doing hair restoration? And what other services do they offer? Because if it's just a menu item, you really can't feel really good about getting great results, because like I said, the hair restoration surgery clinics are popping up all over the place, and they're doing their very best to, you know, look experienced, and it's difficult online a lot of times to tell. So I would strongly suggest that you just go meet with your prospective surgeon, and you should feel absolutely 100% comfortable asking for that surgeon's resume.
Mm-hmm.
Have a look at it. Look for the training, look for the experience, look for the obvious, if it's there, you'll see it, the dedication to the specialty.
Well, I think, you know, one of the things that Jonathan pointed out earlier that might be a useful thing is, did you do this work, these photos you're showing me? Did you
Yeah.
actually, is this one of your patients? Did you do this? I thought that was
Absolutely.
kind of telling. They had, you know, plenty of photos for you to look at, but they didn't do the work. That was kind of interesting.
And you know, not only that, he'll give you a phone number for some of these patients, or actually he'll have a patient call you. In this case, I told him after the procedure, I said, anyone you want me to contact, and they can fire questions at me and ask me, I'll be happy to do it, because I'm happy with my results. I want more people to know about this, and you know, I'm not a stock photo like some of these other
Yeah.
places. So, you know, and I told him, I said, man, I'll come to your office if you want me to, and they can run their fingers through my hair and see that it's real. You did this. We've got pictures, and you know, he's the real thing here in Atlanta. And like I said, do your homework, even if you're not in Atlanta. You know, see if they have a patient that you could talk to, or even meet in person. I mean, that's the result you're going to get.
Have we had patients call you?
You know, I think you've given my number out a few people, yeah. So.
Oh, good.
Dr. Anderson, is there anybody that's not a candidate for this?
Very good question. Yes, actually, and we turned down some patients. The reality is, because hair restoration, the procedure, is a redistribution of hair that you still have, you have to make sure that the hair in the donor area is healthy. And I'm going to back up and talk about just the basics of hair restoration and why it works. The hair on the back and sides of, we'll take a man for instance, because it's more consistent in this manner. The hair on the back and sides of the head, you know, see it, you know, the hair remaining on a typical bald guy, those hairs do not have molecular receptors to the hormones that cause balding in the first place. You can move those hairs anywhere around in the body, and actually the very first hair restoration in this country was done in 1959 by Dr. Norman Orentreich, and he, you know, as was common back in the early days of science, he took a piece of his own scalp right from the back of his head and put it on the inside of his left hairless forearm. 8 months later, he had gorgeous flowing locks of hair coming from the inside of his left arm. And this proved the theory of donor dominance. And I use a tree analogy. A lot of people think, well, what if you put the hair up there where I lost it? Why wouldn't it just go away anyway? And I say, because, well, the hairs are going away because they are hormonally sensitive to a hormone that's causing it. The skin is fine. It's like moving trees around. When you take a deciduous tree and you put it into a pine tree forest, it's not going to turn into a pine tree. It's going to stay a deciduous tree or a maple tree. So the hairs are individually programmed. So they can be moved around, and that's basically why it works, because the hairs are not sensitive to the hormones that cause balding, and that's why the procedure is permanent, because that hairline you create is going to be present forever.
So we're talking about transplant.
Yep.
And we're talking about the procedure, but you've never actually explained what is done.
Very good. What is done is essentially I individually meet with every patient, and just to complete the answer on your last question, I inspect carefully using loops, magnification loops, the hairs in the donor area to make sure there's not a concurrent type of hair loss going on. This is much more common in females where there's hair loss and thinning across the top, but when you look into the donor area and the back and sides, you'll see that there's starting to have some thinning there as well. That's a problem because that tells us that that hair loss is not, or that hair is not exactly permanent, and will change the outcome of the procedure. But in a patient who is a candidate, and that's to answer your question, a patient who would not be a candidate for a hair restoration procedure because it would just be, in my opinion, unethical and a sham procedure. You're not-
Temporary fix.
Yeah, you're not getting anywhere. So if I check and make sure those hairs are nice and what we call terminal hairs, fully grown, then they are removed surgically from the back and sides of the head, and then placed into the areas of need, one hair at a time. We can take them from the donor area in one of two ways, either with the traditional linear strip, and where we take advantage of the fact the scalp moves up and down in the donor area, and I take a little thin strip of it. I do a facelift plastic surgical closure on that. That does leave a permanent linear scar in the donor area on the back and sides of your head. It's not near the ears, it's kind of up there, so you can still wear a ponytail. And then that strip of tissue is then handed to my full-time team of surgical technicians who, under dissection microscopes, separate each follicle from its brother or sister and then sort them out. One-haired follicles over here, two-haired, and so forth. And then all this is going on while I'm making sites where the hairs are going to go and the direction, orientation, and placement of the new hairs. The hairs are then inserted surgically with tiny little jeweler's forceps. Again, all this using loop magnification because hairs are small, and placed into the sites that have been created by me to, to create the new hairline or the new fullness in it where we need it. The hair continues to grow there. It thinks it's still back on the back and sides of the head. The hair still thinks it's in the permanent zone, but in fact, it's in an area where it's the hair has already been lost. So that's how it's done. We can do the other way we can do it is, of course, use the robot, and that's a fascinating piece of technology. We trim the hair down. It has a robotic, a six-jointed arm on the end of which is the surgical, the business end, I call it, and it's got a little tiny punch in there, a 0.9 millimeter punch, and on either side of it are two stereoscopic cameras which 5,000 times a second update the robot's head and time and place, and then it robotically extracts one follicle at a time from the donor area, leaving, we don't use a scalpel, there are no stitches, there's no scarring, you can just get all the hair and then place it into the areas of need, and in the donor area, instead of having that telltale line, there's just little hypopigmentations, maybe some little white dots or lighter colored dots scattered. You really have to shave your head to see. So there's no, it really reduces the obviousness or the evidence really that a hair restoration surgery has even taken place.
So why would you do the robot as opposed to the other one? I mean, how do you decide which is a better?
Well, I offer patients both typically. There are advantages and disadvantages to each, but really in the long term when we look at it, I ask the patient, would you like to ever wear your hair really short in the future? And that's the main consideration because it's, hair restoration surgery, let's face it, there's a lot of foolishness going on in this industry, so to speak, and it kind of has a black eye because of the very unnatural work that was performed in the 70s and 80s. And so and because anybody can do it, a psychiatrist tomorrow could say, I'm a surgeon, I do one. There's a lot of variability. You can do this procedure a million different ways. And so there's, I think, a healthy skepticism in the public towards this procedure. So really, I try not to guide patients. I say, look, any serious hair restoration surgeon is going to offer, I think it's disservice not to offer both methods. But you're going to find a lot of information out there. If a guy only offers one method, he's going to market against the other one and so forth. So really, it's kind of a crazy field out there.
And is a patient put under like general anesthesia?
Oh no, I'll take a day at the spa. You come on in, I have an extremely comfortable chair, you hang out there. I do, patients get a PRP with ACell procedure with every single hair restoration. I do not operate without it. It acts so well to drive the success rate of the grafts to 100%. And then basically they're just given a little bit of Valium, a little bit of Versed, and a comfortable chair. And so really they're sedated. I personally do all the anesthesia. It's all done on local anesthesia, just a little tiny needle and some lidocaine, and in that way the procedure is 100% painless.
It's pretty amazing when you think about it, and they're advancing the technology even further to where the being able to place the hairs into the into their new location is actually going to be done somewhat by the robot now, and then going forward.
It's, available next year will be not the placement but the site making, and that's going to be able to, the robot will be able to make a bunch of sites in a very dense pattern and a very uniform pattern. But I'm personally still going to be doing the frontal hairline, because that's, we as humans are very, very good at picking up patterns, and that's something that I have to kind of make sure is we don't create patterns. I want to ask Jonathan, one of the main concerns of patients is, how painful is it? Can you speak to how painful was it in your words?
It wasn't painful at all. Actually, when you were talking about your chair and everything, I remembered that day. I went in and I could have fallen asleep. I mean, I could just hear you talking, and we were talking back and forth. I did not fall asleep for a little while because, like you said, it was the day at the spa. I mean, I just sat there in the chair, and it was done, and I was like, wow, you guys are done already. And no pain at all. I mean, even the next day, I had the proper medication, and there was no pain. So, yeah, to answer your question, it was great. I mean, I was amazed at the experience of the artist, and I could hear the little punches, and there wasn't even any pressure. It was just real quick, and Ken did a great job, and he made the sites, and that didn't hurt either. And he gave me a mirror and said, "What do you think?" I was like, "Yeah, that's great." So I mean, it's just
fantastic.
it was almost as if I was going in to get a haircut. Instead of getting a haircut, I'm getting hair. I mean, it was. He drew out a hairline. He asked me what I thought about it. It looked great, and he made the sites, and it was. I was amazed at how streamless the process was.
Have you had your first haircut yet?
Yes. I mean, so I got this done in April, and honestly, when I went in to get my hair cut, the lady who cuts my hair did not even know. She had no clue. And then eventually I told her, because I mean, it's such an interesting concept of with today's technology, what you can do now. And I told her, and she said, yeah, I don't believe you. I've seen some bad jobs coming here.
Yeah.
She said, who did it? And I told her, she said, I've got a handful of people I need to tell about this. I said, yeah, tell them to call me. But no, she didn't even notice. Like I said, friends, family, no one notices. And I mean, you're sitting here right now looking at me. Would you ever think, like,
No.
God, this guy has something
No,
done?
no.
It's amazing. I'm fortunate that this technology's out there. I'm fortunate that I walked into the right office.
Yeah.
And, he didn't try to sell me. He showed me results, and I made my own decision. And the cool thing about this office, I didn't get a phone call the next day saying, hey, did you make your decision?
Yeah,
I didn't get one the
yeah.
next week. I actually called them and said, what is your schedule like in 2 months out? Yeah, it's like I said, do your homework, find the right person, whatever town you're in, ask the key questions, who's gonna do it, look at results, and you get what you pay for out there. You're gonna see a lot of specials. Like you said, 2-for-1 deals. Man, that's good when you're
Go the other way.
Yeah, you're talking about tires or something, but it's not good for your hair. So try to avoid some of the scams that are out there, because they are out there. And when you look at this online, you're gonna see some bad jobs. You're gonna see, if you just Google images, it's enough to scare you.
It's like a bad tattoo on your face, essentially.
Yeah.
Really. You have
Right.
to live with it from
That's
now
very
on,
good.
or get
Right.
corrected through some painful process.
Yeah.
We've been talking with Dr. Kenneth Anderson of the Anderson Hair Sciences Center, his teammate, colleague, Sarah Kovac, patient advocate, and then, of course, visiting with a very delighted client for good reason, Jonathan Williamson. And thank you all for taking some time to share information with us. And one of the reasons why I had our next guest join us on the show today, Dr. Anderson is kind of an expert with regards to sharing a great deal of information about what he does in his practice, how it works, talking about patients and their outcomes and letting them tell their stories. And because that's one of the things people really want to be able to do, is to log on to a website. Ken's website is fantastic about that, because there's real patients there. You can get a sense for what he's like even before you step foot in the office. Now we have this kind of content that he can share with his folks, and they can actually hear him talking, hear his passion before they've ever stepped in, so they'll come into the office feeling like they know him. And Dr. Anderson, you want to share your website and social media real quickly?
Yes, our website is www.atlantahairsurgeon.com, and there's links to our Facebook page, our YouTube channel, our Google Plus page, and our Flickr account on that front page. So there's a lot to explore. We have near 150 patient interviews, like John Williamson here, answering various questions. And just like Diane said, very candidly, it's worth checking out. There's some videos about the robot. There's even a surgeon's view of the robot interface. But that's, or they can call 404-256-HAIR. That's 404-256-4247.
Thanks for everybody today taking time out of your busy schedules to come and share some information. What are you going to say?
I was just say thank you very much for having my patient, myself, and my patient advocate on today.
Well, we look forward to talking to you all again real soon.
Okay.
Thank you.